Hey everyone, it's Dr. Hodges, and I am going to be bringing you a series of videos for Obesity Cares Week. I am super pumped. The purpose of Obesity Care Week is to bring information to the masses and to garner support so people can have affordable access, a wider access, and compassionate access to care. So let's just jump right in. This is day one of Obesity Cares Week, and the theme of the day is advocacy and Congress. And I'll have a little link below so that you guys can follow along. They have, if you go to the Obesity Cares Week, I think it's obesitycaresweek.org. If you go to their website, they're going to have links to how you can get involved, because the very first day, it is all about getting our the national leaders to help us with access to care. You know, it's really interesting. Every time that patients come to see me in my office, one of the very first things that we always do is we verify your insurance to see, do you have bariatric coverage or not? Now, here is the kicker. You know, I will get referrals from doctors and they will tell me, and then they will also tell their patients, you know what, I'm just going to write a letter, and if it's medically necessary, it will be covered. Let me tell you, that is not how insurance works. You could have one foot in the grave. They will not care. If it's not a covered benefit, it will not be covered. It does not matter how much we scream, cry, and beg. If it's not a covered benefit on your insurance, it is not a covered benefit. So, part of what we want to try to do with the help of all the collaborators on Obesity Care Week is, if we can get a big enough voice, this needs to be a constant word on the street, and it needs to be the minimum on every insurance plan. You know, I think it's interesting with the Affordable Health Care Act, obesity care and weight management, it's not required. And it really should be. You know, we spend over $200 billion, as with a B, $200 billion alone just on care of patients that are obese, and that's just a BMI over 30. And I live here in the South. I live here in Texas, and our meter for what is a healthy weight, if I hear one more time, Dr. Hodge, I don't want to lose my curves, there's our meter of what we consider a healthy weight or not is greatly skewed. And part of it is because over 60% of the population is overweight or obese. And we just have to change that. I'm not trying to get people into Sports Illustrated, but I do want you to live longer. I want you to be able to like chase your grandkids and then catch them. You know what I mean? I just want you to feel healthier and live the best possible life that you can. So what we need is, we really need to be able to expand healthcare coverage for obesity care. Here's one other thing. The difference between Medicare and commercial insurance. So Medicare is typically for patients over the age of 65. I think you can opt in to Medicare when you're 62 or 63. I can't. Or if you're disabled, you can also qualify for Medicare benefits. That's Medicare. And then there's commercial insurance. And commercial insurance is the kind of insurance is like Blue Cross Blue Shield, United Healthcare, Aetna. These would be the plans that you would get through your employer or through the marketplace. And again, commercial insurers may use Medicare guidelines that are set forth by the government for what they may or may not cover and what they may or may not pay for. So just because something is covered on Medicare does not mean that it's going to be covered on a commercial insurance, and vice versa. Now let me throw one other wrench into this. So if you have Medicare, bariatric surgery is a covered benefit. The medications are not. However, I will tell you, not that I'm biased, I mean, I am a surgeon, but by far, surgery is the best way to lose weight and have the most sustained weight loss. I mean, that's what all the research bears out. Recidivism rate for a simple weight loss plan is at over 95%. That means risk for recurrence of your weight. And that's just with medication and exercise and diet alone. So by far, surgery is superior to medical weight loss in terms of reaching your long-term weight loss goals. If you have Medicare, bariatric surgery is a covered benefit. However, if you have a Medicare replacement plan, and that is your primary insurance, so, hang on one second. Sorry about that. There was a great big fire truck. If you have a Medicare replacement plan, not one of the backup plans, but that's the primary plan, not all of them cover everything that Medicare does. And not all of them even have the same deductible. I have had many patients that come to me with a Medicare replacement plan, and they're super pumped. They're like, I want my surgery. I'm like, oh, you should have just taken traditional Medicare. Your plan doesn't cover bariatric surgery, even though it's a Medicare replacement plan. But that's a whole nother topic for a whole nother day. But typically my advice is get traditional Medicare. I've told my mom, do not get a Medicare replacement plan. If you want to get an ancillary, like I think she has AARP as a secondary to like help with prescriptions and stuff, but she has traditional Medicare. I've made her change it. So with that being said, the only way to expand coverage for bariatric care is really going to be advocating for it, and it's about getting the word out, and it's about properly educating our legislators both at the state and at the national level so that we can get the coverage that we need. Now, with all that being said, I just want you to know that when my patients come to see me, I want to help them in any way that they can, even if they don't have surgical coverage. We always will try to move forward with medical weight loss plan. I always say, I don't care how you get there, I just want you to get there. So, but I hope that this has really helped. I want everybody to go and take the pledge, the commitment to care, on the OCW website. The other thing that I want you to do is there's also a link. It's pre-made so we can advocate for ourselves to the Trump administration to expand coverage and care. Hope this helps.